So the way the task force came to the recommendations was they made a list of what they considered the benefits of screening to be, and a list of what they considered the harms to be. Now remember, the way they determined the benefits was based on those studies done 30 to 50 years ago, which showed a mortality reduction from breast cancer in the order of 15 to 20%. So they started out with a relatively lower risk, lower likelihood of benefit, and then they looked at the harms. And what did they think the harms were? The main harm that they considered was the anxiety that women go through if they're recalled from a mammogram. They call that a false positive. But if a woman has a mammogram and gets called back for more tests, she's understandably nervous while she's waiting for those tests to be done. And sometimes it can take a few weeks before she finds out that she doesn't have cancer. The other harm they considered was something called overdiagnosis. And that's the possibility that we will find a cancer in her and she'll get treated for it, but she'll die first of something else, so that theoretically she would never have died from her cancer. Let me give you a silly example to start with. If a woman gets diagnosed with a small cancer and she has her treatment and she finishes her treatment and the next day she gets in a car accident and dies. Well, that's a silly example, but that woman was not going to die of her breast cancer because she was destined to die, if you will, from the car accident. Of course, nobody knew she was going to have a car accident, so we treated her cancer. But that's a theoretical example. Another example, and this is more likely with older women. Let's say a woman has cancer and she gets treated for it, but she dies of a heart attack or a stroke. Now, we didn't know she was going to have the heart attack or the stroke, so we treated her cancer. And that is still an example of overdiagnosis. Now, overdiagnosis is much more common as women get older, in elderly women who are more likely to develop heart attacks or even other cancers. But the concept of overdiagnosis is negligible in younger women because they're much less likely to die of something else first. Now, the task force has encouraged shared decision-making between a woman and her doctor so that she can decide whether she should have screening. But the task force is giving physicians and women inaccurate information on which to base that decision. For example, they're saying that mammograms reduce the deaths from breast cancer by 15 to 20%. Well, 50 to 30 years ago, in the randomized trial setting, that was true. But we know from much more recent research that women who have mammograms are 40 to 60% less likely to die of breast cancer. Now, if you're weighing benefits and harms, you really need the accurate terms and the accurate data for the benefits. What's the likelihood that having a mammogram could save my life? And when I'm making the decision for myself and when I'm counseling patients and friends, there's no doubt that the benefits of a mammogram, the potential of finding a cancer early, outweighs the harm, which is transient anxiety while you're waiting for the test to get done, or the negligible possibility of overdiagnosis. Furthermore, in addition to the benefit of less likelihood of dying, there are three other important benefits of early detection that the task force didn't consider at all. The first is that when we find a cancer early, women are much more likely to be candidates for a lumpectomy instead of a mastectomy. And most women consider that a pretty important benefit. When women have cancer detected earlier, they can have something called a sentinel node biopsy instead of the big armpit surgery that used to be standard. And that's important because one of the complications of that surgery is a condition called lymphedema, where the woman can get swelling of the arm and hand on the side of her surgery. And that's permanent. And the third most important benefit, perhaps, when we find cancer early, and nowadays with genomic testing of tumors, a large number of women can avoid chemotherapy altogether. The task force didn't consider that as a benefit. So when a woman's having this shared decision-making conversation with her family doctor, those aren't even going to come up in discussion. And women deserve that information before they make an important decision like when to have a mammogram.